Hello, I'm Dr. David Mehlman, here with the Northwestern Medicine Bloom Cardiovascular Institute, and we're celebrating the 41st Annual Northwestern Medicine Echocardiography course. For me, it's just the 40th year. I missed the first one, but we wanted to give you some highlights of what is being discussed at the conference today. With me today is one of my colleagues, Dr. Nausheen Akhter, who has spent much of her clinical time dealing with cardio-oncology. As an echocardiographer with me in the Echo Lab, she has a great deal to share with both me and you regarding the combination of cardiology, echocardiography, and oncology. Nausheen, I have a few questions to ask you. First, what are the most common reasons why people might send a patient to you in consultation regarding cardio-oncology problems?
Thank you, David. The American Society of Clinical Oncology put forth a guideline statement in 2016 in which they proposed 3 distinct time points for referral of patients to a cardiologist, and those include before starting cancer treatment, during cancer treatment, and then following cancer treatment. So this idea of a pre-treatment cardiovascular risk assessment is for patients with known cardiovascular disease and those who have modifiable risk factors for cancer who will be undergoing treatment for potentially cardiotoxic chemotherapy. Patients who are referred during cancer treatment, the majority of that population are patients who develop cardiomyopathies, and a large proportion of that group of patients are breast cancer patients. Patients who are referred after cancer treatment is completed usually come from survivorship clinics or from primary care doctors.
How do you use echocardiography in your practice?
Echocardiography has a really central role in cardio-oncology. As cancer treatment has evolved and improved, so has our ability to detect early changes in cancer in the heart and the heart mechanics. We are thrilled to have at Echo Northwestern this year Dr. Dinesh Travindanathan, who will be going into this in great detail, take a deep dive into these advancements in echo technology, including strain imaging and 3D echocardiography. I review echoes on almost every patient referred to cardio-oncology clinic, and then collaborate with my colleagues with Lurie Cancer Center and coming up with a collaborative plan for these patients. We'll be discussing some of these cases at Echo Northwestern as well to really highlight the utility of echo in the management of cancer patients.
How often do you get echocardiograms in patients, and at what point in their treatment do you get those echocardiograms?
Echocardiograms in the adult cancer patient population is really dependent on the drug. So there's drug-specific protocols, and then there are also clinical trial-specific protocols that we follow. And this, as cancer treatment evolves, will also evolve. There are patients, for example, patients with HER2-positive breast cancer who require, if they have early-stage disease, will require up to 5 echoes in the year of treatment. So one at baseline and every 3 months and at completion. And this is FDA approved. We also rely on our cardiac MRI colleagues, and cardiac MRI also has a place in a multimodality assessment of our patients. We use cardiac MRI for the assessment of etiologies for new left ventricular dysfunction, if there is a question or suspicion of myocarditis on immunotherapy, and for pericardial disease.
Nausheen, how does strain work in with this imaging?
So strain imaging is a new technology. I think that it has a very robust clinical utility within cardio-oncology, and we are using it specifically. It was specifically shown in our breast cancer population, and now it's being studied in other cancer populations, but it has been shown to have a prognostic utility for which changes in strain can predate changes in ejection fraction in women with breast cancer who have received serial treatment with anthracycline followed by Herceptin.
What else do you think I should be asking you so that viewers might get a better idea as to what's going on with cardio-oncology now?
think there's a lot of excitement in cardio-oncology right now. There's a lot of, there's a new journal that will be starting this month, JACC Cardio-Oncology, and will continue to explore the relationship between heart disease and cancer, not just common risk factors between them, but how we can look at the treatment within both oncology and cancer and its effects on both disease systems.
I would like to thank Dr. Nausheen Akhter for joining me to discuss cardio-oncology